Good morning everyone, this is Lahari from 2nd BHMS. Now we'll be moving to the palpation. It is the process of tactile method of assessing the internal organs, soft tissues and underlying lymph nodes. There are 7 components in the palpation. They are shape of the chest, movement of the chest, tracheal position, apical impulse and spinal deformities, tenderness of the chest and also lastly vocal fermitus. Now the first component of the palpation is shape of the chest. Now I'll be demonstrating about the shape of the chest. The normal ratio of the chest is transverse diameter to the anterior posterior diameter is 7:5 ratio. We have to take 2 cardboards and then we have to see there is no bending, inward bending of those cardboards. We have to measure from the anterior axillary line of one side to the anterior axillary line of the other side. Here we can see the fold of the axilla. From there we have to measure. It is 29 centimeters. Now we have to measure the anterior posterior diameter. We have to ask the patient to put his hands on the head. Here we have to measure from the anterior axillary line to the posterior axillary line. It is 17 centimeters. Any deviation in this ratio represents that there is a flat chest or barrel chest. Thank you.
Good morning everyone, myself Arekya.
Myself Harshita, we are from 2nd BHMS. We are moving into second component of the palpation, that is movements of the chest. She is going to explain the process and I am going to demonstrate the process.
In palpation, we are going to palpate in superior part, anterior part and posterior part, lateral part. In superior part, we have to place the fingers in supraclavicular fossa and feel with the fingers.
Inspiration. Exhale. 1 second. Here we see that my fingers are little moving upwards when he is inspiring the air and little coming again to recoil position when he is expiration, when he is doing expiration.
Next, in anterior part, we have to place 2 thumbs on the mid-sternal